Welcome viewers out there to our Talks for Better Living. I'm Kokwanaelta. I hope everyone is fine and safe at home by God's grace. Today we have got a special visitor. Dr. Mgiba. So Dr. Mgiba is going to share with us everything about prematurity. So Dr. Mgiba, you are welcome.
Thank you, Elta. I am Posakufa Wilson Mgiba, one of the alumni of Maripi Orvelan. I greet you all and welcome you to this meeting. Presently, I work here in Bushbuckridge as a private medical doctor, a GP. Otherwise in Remasana for some time and retired from there, and now I'm in private practice. Thank you, Susan.
Or some people don't want to take their knowledge with them to retirement. They still want to benefit us.
Yeah.
Oh, that's brilliant. So, doctor, can you tell us, when do we say a baby is preterm or premature, or what makes them premature, or all those stories?
No, thank you for the question. Prematurity preterm babies are babies born before term. Now the question immediately arises, what is term? Term is when a baby is born after 37 completed weeks of pregnancy. Normally we say 40 weeks, that's when a baby should be born. But it does go up to 42 weeks, and it comes down up to 37 weeks. So that is term. So when a baby is born during that time, that's a full-term baby. Usually they've got no problems. They get born, they're taken home if there are no complications, and they continue to grow until adulthood. So without any issues. So now the problem starts when babies get born before 37 completed weeks. Those births are called preterm births, and the babies born are referred to as preterm babies or premature babies. Now, this is not what nature would like to see happen. Nature would like to see people born after 37 completed weeks. But this world, as we know it, lots of things happen. And people do get born before 37 weeks. And that comes with its own problems, because there's a reason why a person must be born at 10. And the reason is when you are born, you are fully equipped, you are mature enough to live, breathe, eat while outside of your mother's womb. But when you are preterm, you are not ready to live that comfortable environment and come to this harsh world, because some of your body organs are not ready. In fact, all of them. The lungs in particular, the heart, the liver, your metabolism, you are just not ready to live outside the mother's womb. So when we say preterm babies, we mean babies that are born before time, babies that are not quite ready.
So when they are delivered at that age, when do they send them home?
Yes. Prematurity is a big problem, like I just alluded to. This is a worldwide problem. Elta, about 15 million premature babies are born worldwide every year, right? And you can see how big the problem is. And they say about what? Just over 80% of those are born in Sub-Saharan Africa, and South Asia. So already that tells the story. Now, the smaller the premature baby is, the more likely are they to die, because they are premature, full stop. They just can't live unless they are got early and managed properly. Even then, many of them still die, even in the best of hands. Now, maybe I should go back a little and say, there are those that are born between 36 and 37. Those that are born between 34 and 37. Those that are born between 32 and 34. And those that are born below that. So the earlier you are born before term, the more likely you run into problems. Amongst the preterm world, the ones that survive better are those that are born late. In other words, closer towards 37 weeks. They are bigger, and many of them are bigger than 900 grams, right? So those ones tend to survive a bit more, but it's a tough battle, right? But the ones below 800, the survival rate there is very bad. Let me just give you an example, this Elta. This is now South Africa. Our neonatal mortality rate of all babies born with 1 kilogram and more, right, is about 8 in 1,000. In other words, 8 out of 1,000 will die, right, of those with birth weight above 1 kilogram. But those with weight below that, the mortality rate is up to 60 out of every 100 born. So you can see it is a very big problem, right? And the problem is simple. When these babies are born, those who are going to manage them have to try and make sure that they put the babies, well, first of all, they're admitted in hospital, in nurseries, and maybe in incubators, and so many ways of managing them. But the primary reason is to create an environment in which these babies can continue to grow. An environment that is similar to the intrauterine space environment where they were when whatever happened got them to be born prematurely. So they need to be put in that environment and managed in that environment so that they continue to grow. What does the intrauterine environment provide, right? In other words, when they're inside their mother's wombs, what do they get, right? They get security, they get warmth, they get nutrition, they get comfort, they even play. That is the best environment for premature babies, right? They stay there and grow until they are, big enough to be born and ready, outgrow their food inside the womb. Loko va velekiwa va fanele va tekiwa va yisiwa xibedhlele loko va nga ri xibedhlele. Loko va ri xibedhlele va fanele va admitiwa, va managiwa emisari, preferably hi vanhu lava nga dyondzela swoho swa ti-neonates, right? Lava va tivaka ku handle mhaka leyi. So, but like I said, the primary aim there is to get these babies in an environment where they will continue to grow. In other words, they continue in an environment that is similar to what it was inside their mother's wombs, right? Fanele swi kuma swakudya, swi fanele swi pfuniwa swo tala swa swona a swi hefemuli kahle, swi fanele swi pfuniwa with breathing, a swi dyi kahle, swi fanele swi pfuniwa with feeding. They can manage their own temperature. The temperature is very important in a baby. They quickly become hypothermic and they can die out of that. And the reason is that their metabolism is still immature. Another common problem in this age group is that of jaundice. The mastanda is yellow because the liver is immature and the blood is weak. Generally, they are fraught with those problems, and many of them die. And if they get infection, it spreads quickly, and they die because their immune system is also immature. So where they are nest, the health workers must make sure that they prevent infection. Over and above all that, oxygen and so on, and feeding, fluid therapy. But the main thing is to buy time. If they get all these things, they continue to grow until they reach a certain age where they catch up with their full-time counterparts.
So until they are able to look after themselves like a full-term baby, they stay in the hospital.
Yes, they stay in hospital until they stabilize, until they're mature enough. In trying to create an environment that is similar to that of the womb, the people who manage preterm babies have come up with two tools, largely, that we know of today. One, the so-called incubators, right? It provides everything, warmth. You can manage the temperature there. The baby can be given oxygen there. They can be assisted with breathing there. They can have drips and be fed while in the incubator. And everything can be done for them and they grow every day, right? And unless they are too small and too premature and unstable, right? They don't go into the incubators. It is the stable ones who have got mild problems who can be put into a system called kangaroo mother care. Right? The kangaroos in Australia have got pouches just in front of their bellies where they keep their babies. The babies grow in there, they get fed in there, they never come out until they're ready to come out, right? So someone came up with the idea that kangaroo mother care is very effective in managing the preterm babies, right? And those that are stable can be put in there. And the operative word there is skin to skin contact with the mother. So the baby is put on the chest of the mother, wrapped with its skin naked in front, and the mother's skin also naked in front. So it's skin to skin contact. And then they cover the baby and the mother with a blanket, some nice comfortable clothing, and then a blanket, but making sure that the baby is able to breathe comfortably and can move comfortably, and the mother too can move, and so making sure everything is comfortable. But the main objective there is to make sure that the heat from the mother goes to the baby, right? And sustains the baby. It will never be too hot or too cold. It's just the right temperature. And also, food is just next door. The baby gets its milk from the breast right there. And it is breast milk that must always be given to the baby. If for some reason you can't breastfeed, the breast must be expressed to provide the milk, which will then be given to the baby. But it must be breast milk because the gut of the baby may be, it's largely immature, and there are complications that can arise if some other food is given to that baby. So breast milk is the best. So the baby will stay there. There must be continuous contact with the mother. Only interrupted when there's baby changing, birthing of the baby, but the baby must be in contact with the mother. And they've seen even lately that even if the baby is in an incubator, kangaroo care, mother care can be practiced even for 10 minutes, 30 minutes, 1 hour. It creates a very big difference, right? Babies' problems sort of, become better. The babies They're used to the heartbeat of the mother.
Mm.
They're used to the voice of the mother. They've got peas, milk is just there. And when it's on the chest, um, uh, more milk is produced, right? More milk is produced. So there's enough food. The weight gain is, accelerated. They say there are even less complications of the brain, and the development generally is faster. And these babies, when they are awake, are more alert of their surroundings than those that are in incubators. And eventually, they tend to be discharged much earlier than those which are in incubators. So, besides being that effective, this tool, kangaroo mother care, is cheap. That's very cost effective. It's very effective, as I've just stated, and it doesn't require sophisticated technology, right? It's very simple, it's basic. And you don't need highly qualified nurses and professionals and doctors to make sure it happens. As long as people understand it, they can get very far, as long as the baby is stable. So it is a very, very effective tool, particularly in the countries I mentioned, so-called third world, where there is dearth of specialists and money to buy this sophisticated equipment, and which are very complex in operating. So with kangaroo mother care, you can get very far, and it's to be advocated in those countries. Although even in the first world, it's used. It's very, very effective, yes.
I know that's very interesting. We often see fathers in some units as well. When they're coming to visit those babies, you find them putting those babies inside and they walk around as if they are pregnant.
Exactly. In fact, it's a family issue. When a baby is to be put in this type of care, the whole family must understand. Because the mother will be dislocated for some time just to make sure that she's available for the baby. And everyone in the family must understand. But if she must go somewhere, someone must take over and give the warmth that the baby needs. It is very, very, and of course, if they're in hospital, fathers and other members of the family are encouraged to come and visit, to familiarize themselves with what they see, and to see this abnormal situation that, this is how they handle it. And the more you get used to it, the more you see that, no, this is fine, it's normal, it's necessary. The baby is better than last week, and so on. So an abnormal looking situation tends to, to appear more and more normal.
Yeah. That's quite interesting, So when they finally are sent home now, is there any specific type of care that mothers should really consider when they are at home?
Yes. Yeah, the babies get discharged from hospital when a certain criteria is met. Number one, where they talk about 1.8 to 2.5 kilograms. Following, if they are born at, say, 36 weeks, you want to keep them until they're at least 38 weeks gestation. In other words, normal, if everything is going well, by that age, they can be discharged because it means they can feed, they can do, but upon discharge, the baby must be feeding well. The baby must not have complications that require hospitalization. The mother must be confident about giving kangaroo mother care at home. And she must understand everything about it. And she must agree to coming back to hospital, especially the first week is critical, to come back and be reviewed to see what is happening to the weight. Because that's the other criteria. The weight must be progressively going up before the baby is discharged. Because if it's not, then we run into problems quickly and then we come back with complications. So the baby must be feeding well, must be growing, must be comfortable, must be breathing well, and the mother must be confident about giving kangaroo mother care and must be prepared to bring the baby home back to hospital for weaning. And if everything is okay at 31st week after admission, after discharge from hospital, then the baby can be seen every 2 weeks for a few months. And if everything continues to be okay, then they can be fine. They're just like normal other babies where they are pursued according to the other protocol of normal babies.
As long as the weight is fine, as you said. So if they reach that age, the maturity kicks off as well and carry on like a normal baby, right?
Yeah, they carry on like a normal baby. The mother can be advised to wean off the baby from kangaroo care, right?
Yeah.
Then
I think the kangaroo care, doctor, it continues for life, because even us at this age, we still want to be cuddled. I think that's where it comes from.
Yeah, it continues for life, but
for life.
Yeah.
So thank you so much for that, Dr. Mgiba. And lastly, just a general message to all mothers there for advice and maybe a word of strengthening them, because other parents feels maybe it's their fault that babies came premature, or others are scared. Others thinks these babies will always be cold because they're premature. Others, there are so many stories that people are afraid of. So just a way of support and encouraging those mothers.
Generally, I would say the problem of prematurity is not for specific mothers. It is a problem of all mothers the world over, right? In all the races, not all locations. So that problem is there. However, there are some risk factors that can lead to one getting a preterm baby. Several of them.
Yeah.
One, poor management at antenatal care, where even if there are problems, people don't pay particular attention and refer such mothers in time to hospital for further care. You get complications arising, and the baby being rushed to hospital, mother being rushed to hospital only to give birth to a preterm baby. So antenatal care the people managing that system must be very up to date. They must know when the blood pressure is like this, when the sugar is like this, this is what we must do, right? So that's the one thing. Two, people with high blood pressure must know that when they fall pregnant, there's a high chance of getting a preterm baby unless that blood pressure is properly managed. People with sugar diabetes, same thing. People with multiple pregnancies. In other words, if you've got twins, you are more likely to have a preterm labor than a person with just one baby. Right? The more the babies, the more the likelihood of giving birth to a preterm baby. Very lean mothers, right? Not necessarily malnourished, very lean mothers, and very overweight mothers are likely to give birth to preterm babies. Even generally poorly nourished mothers are also likely. That might explain why this is in some way also a socioeconomic disease, right? Are more likely to get that. People with problems of the womb, right? Either the cervix or the womb itself, maybe it's fibrous or maybe it's abnormal in some way, could have babies born preterm, right? And they could run into this problem. And there's several infections, right? When there is infection, usually of the urinary tract, but also of the womb itself, intrauterine infection can precipitate or can cause delivery of a preterm baby. There are several of them. So these are just some of them. So but the large majority, people are just born preterm without any obvious reason, right? People don't know why this one got a preterm baby. So it's not known. But the big thing for mothers is that babies that have been born preterm, if everything goes well, there are no complications developing, they do grow to normal and they do have normal intellectual functioning afterwards. And some of them do exceptionally well. I've seen, they've been preterm. Yeah. And however, there could be problems arising out of prematurity later on in life, right? Because these babies are small and literally fragile. So, and being outside of the womb, the brain, for instance, can suffer certain insults like physical injury or lack of oxygen. We said they got difficulty breathing. If they don't get enough oxygen, the brain suffers. And that can lead to what we call cerebral palsy. Now, this is a huge burden for families because while the child grows physically, they don't grow so well intellectually. They can't cater for themselves, they can't feed themselves, they can't do anything for themselves. And that's a big problem for families and lots of people with babies like this. And also, learning at school becomes a problem with some of them, many of them, right? All because of having had prematurity and some kind of problem to the brain. And others will have other problems like they talk about teething, chronic, general ill health, infections, asthma. These babies will have those, and it's a very big problem. So when mothers have something that they're not sure of during pregnancy, must take action early. And when they miss the first period, they must go book in early and make sure after the diagnosis of pregnancy is made that they stick to the letter. Because those 9 months are crucial in everybody's life. Very important. And the mother plays a big role in them. The other thing worth mentioning is that if you smoke, if you drink, if you take drugs, during pregnancy, you could give birth to a preterm baby, right? And with all those problems. So when mothers are pregnant, they must make sure the full-time job is to look after their unborn baby.
Yeah, that's very interesting. Very interesting. And thank you so much, Dr. Mgiba. I really appreciate this. I got educated myself. We feel so privileged to have you here, Doctor.
Thank you very much, Sister Lita, for the opportunity. It is, I'm not a lecturer or anything, no. Just to share knowledge. And I like it because I feel relaxed discussing with you in a relaxed manner. But otherwise, thank the viewers. I hope they learned something out of this. I hope it was meaningful to many of them. And what I can say, it is not just giving birth to prematurity is not just the mother's problem. It is the family, the entire family's problem. It's the entire community's problem. So when we see our young ladies pregnant or mothers pregnant, they must be taken care of. Because another thing that I should have mentioned in these days of violence in families is trauma. You see, people being kicked in the belly, being hit in the belly with all sorts of things that can precipitate not only injury but also preterm labor. And so pregnant mothers are extremely special people in communities. They need to be looked after physically, nutritionally, psychologically, emotionally, because all those things do work together to cause problems in the baby, right? So most special asset, if there's any message I could leave, is that when you see a pregnant woman, you are seeing a very important person in the community, and they need to be looked after very well because they're carrying the future, literally.
Yeah.
Thank you very much.
Oh, thank you so much, Doctor. Thank you so much. We feel so privileged to have people like you in our society. So viewers out there, if you have got any question, just write it down there on the comment side, and then we can see how to help you with those questions. And of course, if you want to add, because there are doctors out there, there are so many health professionals that can add more on what we have said and benefit everyone else. Even if you think you are old, you have got grandchildren that can benefit from that. And one day you'll be asked to look after that premature grandchild. So you are knowledgeable already. So stay blessed and bye for now.